So today I'm going to speak about the histology and the anatomy of the bone. Primarily, I would be looking at the basic or the foundation qualities of a bone, and in the perspective of histology, where I would speaking about some what the cells that are found inside, and the types of bone that we come across, and also how the no some of the functions that usually takes place in the bone. With that, I'll be touching a few questions that have come in past papers, and then with that, I will be looking in the second tutorial. I will be going I will be trying to speak about some of the diseases which are associated with the musculoskeletal system, especially regarding the bone. So initially, before starting anything, I would like to start discussing about the basic anatomy or the basic histology that is associated with bone or the osteology. So basically, if you look at this, the bones compose of three main types of cells. What are they? They are the osteoblasts, which produce bone. Then there's the osteocytes. Osteocytes are not as most of you would like to say that osteocytes are non-functioning cells, but they have their function as well. But it is a form of an inactivated modality of osteoblasts which do not have the capacity to produce osteoid or new bone tissue. So these are osteocytes, and then there is the osteoclast. So these are the three types of cells that you would appreciate in bone tissue, right? So along with that, the other thing that I would like to say is there are two types of bone that you would come across. What are the two types? Now these are some very elementary stuff that you already know, might be knowing from your O levels as well, but just going to reiterate them just to get an approach to this particular lesson. So two types. One would be the trabecular bone. The other name that we can use is cortical bone, or else it could be the other type is the spongy bone. So given this, um, there are upon further classification, there are the normal bone can be further divided into two types regarding the orientation or the way the collagen fibers that are arranged. So according to the arrangement, the microscopic structure of bone can be divided into two types, which are the woven bone and the lamella bone. So I'll be going through this in a very descriptive manner, but just for the sake of getting an approach that I have nomenclatured these. So primarily, now if you look at the bone, the structure of the bone, initially I would like to discuss about the trabecular bone or the cortical bone. Now in the cortical bone, what you would see, it's something like this. You would see that there are it forms certain structures which are known as osteon or the Haversian system. So there are multiple units of bone or osteons that are present within a single bony structure when it comes to trabecular or cortical bones. So the Haversian system consists of concentrated concentric shells of structures which are called lamella. Now there are concentric shells. So this is how it forms. These concentric shells are known as lamella. What does the lamella compose of? The lamella has spaces which are known as lacunae. So these lacunae are composed of multiple number of cells which are known as osteocytes. Now, since in some examinations they would like to speak about some of the minor points that are associated, so I just give them as well. The osteocytes have a ability to communicate with one another by means of gap junctions that are present. And what else? These osteocytes that are present within lacunae forms structures which are found communicating with one another. These structures again forms an important part of the the Hessian system. And with that, what I would like to say is that these are ossified as well. And in the middle of an osteon, you would find the presence of a canal. This canal is known as the Hessian canal. The Hessian canal is composed of arteries, nerves, and veins. So, as all of you know, that these cells are living, so they this requires its share of blood, oxygen, and other nutrition as well. So, this is brought about by the arteries that are found within the Hessian canal. So, this is a simple osteon. Now, there are multiple number of osteons present in a bony structure. Now, apart from this, now these are the lamella. There are interstitial fibers which are found in between two uh, Hessian systems or osteons that are present in the vicinity. These are known as interstitial lamella. So these are known as interstitial lamella. Now I'll use some other color. So between two osteons, you find interstitial lamella. Right. What else? Now, as you can see, the normal structure of a cortical bone, or let's for an example, we'll take a long bone such as this. So the cortical bone has the outer layer, which is called the periosteum. Now, this is the periosteum, outer layer, which is the periosteum. I'll try to take a new screen to this so that I can depict this in a more clear manner. So this is the outermost layer, which is known as the periosteum. Inside the periosteum, you would see that there are small Hessian systems. Between the osteons of the Hessian system, you would find interstitial lamellae. And within the osteons, you would see concentric lamellae as well, lacunae, osteocytes, and further inside them, you would see the Hessian canal. Sometimes you find Hessian canals communicating with one another through via certain other structures which are known as Walkman canals. Right. Now, if you look closely in your microscope, you would see that there are collagen fibers that are arranged close to the periosteum, which are found close to the periosteum. Now, I'm just exaggerating this. Close to the periosteum, which are found arranged in a concentric manner but outside to that of the Haversian system. These are known as external circumferential lamellae, whereas the lamellae that are found within the osteons or the Haversian system is known as internal internal circumferential lamellae. Now, I hope that you're clear with this. Right. So, as you see, now this is the periosteum, and you see the Haversian system in this colored area. And then inside this, you see a cavity like space. The cavity, now I'm going to use red color. This cavity is composed of bony struts, which is component of the spongy bone. This is the usual arrangement that you see in most of the bones. So the spongy bone, which is occupied by bone marrow. Are we clear? So bone marrow, which plays an important part in it in hematopoiesis, production of blood cells in the blood cells as well as certain other functions as well. So bone marrow is occupied within the spongy bone. The spaces that are found between the bony struts. Good. So if you look closely, the outermost layer is called the periosteum. Outermost layer is called the periosteum. This composed of collagen fibers. Apart from that, it also has cells which has the capacity to produce new bone. So it consists of certain cells which are known as the periosteum consists of cells which are known as osteoprogenitor cells. This is why it is more important. Now, this is why sometimes when the bone fractures or bone undergoes some sort of a trauma, the periosteum, once it gets damaged, it has its potential to rebuild the bone back again, heal the bone. This is because of the presence of these cells. The periosteum composed of osteoprogenitor cells as well as osteoblast cells, which have the capacity to produce new bone cells. So, and also it has these thick, developed collagen fibers which will bind the periosteum to the bone. These are known as Shapes fibers. Shapes fibers. Again, these are form of a collagen which has its adhesive qualities. Yeah. So, in addition to this, now you would see the, there is also a small layer which I would like showing some other color. Let's take blue. Yeah. So there's another layer inner to the periosteum. This layer, which is found infiltrating or merging with the spongy bone, it is known as the endosteum. So these are the two categories, two layers where we see both the periosteum and the endosteum. But the inner to the endosteum, you would find some other bone type which is known as spongy bone, which composed of struts, which is occupied of where there are multiple number of spaces. These spaces are occupied by means of bony marrow. Red bone marrow, important in production of blood cells, but there is also a possibility now with time some of the red bone marrow becomes infiltrated with fat. The fatty tissue is known as the yellow bone marrow, which has nothing to do with hematopoiesis or the production of blood cells. Good. Now, if we look at the types of bones that you come across, According to the shape, now there are two types of bone as we discussed. There's the trabecular bone and the spongy bone. In addition to this, according to the bony entities, according to the bony structure, we divide bones to different types. One would be the long bones, the other would be the flat bones. The other, of course, which has rather a shorter form is known as short bones, and which cannot be taken into anything of this sort, which is known as innominate bone. Innominate bone, irregular bones such as the vertebrae, irregular bones. Uh, There are also few other bones which are known as sesamoid, which act as bony pieces that are present in within ligaments, within tendons, not ligaments, within tendons, which has its function to reduce friction as uh, movement takes place. So these are something very not very important, but not important, but they do not have its major function when it comes to the discussion of bones. So this can be divided according to the structure. So the bones are classified according to structure. Now the long bones, usually the long bone composed of something similar to this. The ideal example that you would be looking for would be the humerus or the femur. Now in this, there are extremities. The extremities are known as the epiphysis. The elongated area is known as the diaphysis. And of course, the area that is merging in between the epiphysis and the diaphysis is known as the metaphysis. One important factor for you to remember is that once if a growing bone is seen in an X-ray, usually the X-ray will show a radio opaque area because of the calcification. But the metaphysis will have a degree of translucency because of the fact it has cartilage. The metaphysis is composed of a region which is known as the epiphyseal plate. This epiphyseal plate is still cartilaginous and will not show a radio opacity when it comes to an X-ray. So this is how a growing bone is differentiated from an adult bone. A growing bone will have its epiphyseal plates, but an adult bone where the ossification is complete or the bone production is complete, you wouldn't see such an entity. Right. So epiphysis, diaphysis. But in a flat bone, if you look closely at the flat bone, where flat bones are seen in skull, in the sternum. So in a flat bone, you would see two plates. Something that I have to add further is the within these long bones, in the central cavity, you would see the presence of a cavity which is composed of um, bone marrow, and also at the ends, at the epiphysis, you would see spongy bony struts. But in flat bones you would see two plates, and in this plates, between these plates, sandwiched in between, there are bony struts, the bony struts which compose of bone marrow. This is in fact, in the skull, it is the term that we use is diplo, because these are spongy bone that are present in between two trabecular bony plates. Good. So this is the normal structure that I have to take into account, right? So looking at now, now the structure is somewhat, now you have gone through the structure. Now before going into the ossification of how the mineralization takes place, I just want to give a brief idea about the types of cells that you encounter. Now there's the osteoblasts. Now what are osteoblasts? Osteoblasts are cells which has the capacity to produce collagen. Type 1 collagen is the one that you can find, and there are two types of osteoblasts, the active ones and the non-active. How can you differentiate? The active are more basophilic, and these active cells have the capacity to produce or secrete osteoid, and also it secretes certain other important material as well, such as the glycoproteins. There are uh, along with that, it involves in the formation of the mineralized matrix of the bone as well. So these are important. Non-active are less basophilic, and also they are not very active. They do not produce collagen. So the main function is to produce collagen 1. These osteoblasts, now what happens is that these osteoblasts, once they start secreting osteoid, which is the non-mineralized form of the bone, which later becomes deposited with calcium and other materials, the inorganic components, forming the bony matrix. And also what would happen is that once these cells becomes active, the osteoblasts, they go on secreting the bony matrix. However, with time, because they get trapped within the calcified regions. Now let's assume that there has been a cell, there was a cell, there was osteoblast cell, it has produced its bony matrix to the vicinity, and once this is completely calcified, what would happen? The problem that the osteoblast faces is that it becomes trapped inside within a cavity. So this is why now at this stage the osteoblast will not retain its activeness. Therefore this will convert or transform to a structure which is known as osteocytes. These osteocytes, so these are present at multiple units. Now the cavity in which the osteoblasts were initially present was known as the lacunae. The lacunae are calcified in the vicinity, and now osteoblasts have converted to form an inactive cell which is known as a osteocytes, which is not completely inactive, but it does not have the propensity to produce bony matrix. So osteocytes, these osteocytes which are present at multiple units, now starts communicating. Initially even the osteoblasts had communication, but what happened was that these communication, the structures which allowed the communication was known as dendrites. What happened later was that in the vicinity of the dendrites there was the calcification, and so therefore later these dendrites have now transformed in such a way to form a tunnel-like structure which allows communication between the lacunae and the osteocytes. So these dendritic processes are sensitive to mechanical stress. This is why now, so let's assume now, because of the actions that are carried out by bones and due to certain stress movements as well as gravity itself has this implication of the dendrites. Now once, because these are stress sensitive, what it does is that it will stimulate bone remodeling. This is an important process where the cells, you would see cells working, osteoblasts and the other osteoclasts as well. I have not still said about it, but these cells work in a more or less an harmonical manner to make sure that the bone is kept in a very strong, force resistant manner, or in a more or less a very good structure. So bone remodeling process has to happen. If for this, the dendrites carry out an important process, and it is important. The sensitivity is relayed for the bone remodeling via a chemical substance which is known as sclerostin. So this is something you can remember. How now, this is why sometimes when people are subjected to weightlessness, let's for an example takes um astronauts. The astronauts play now once they be in space for a very long period and they comes back to earth, they would find that their bones are weaker than usual. This is because now the mechanical stress has not been there for a long period of time, and the bone remodeling has somewhat lessened, and therefore their new bone, the bone that is already present, are much weaker and brittle, and they can easily fracture. So um, but this is not evident in people who are in gravity subjected to gravity and also mechanical stress here in everyday life, because the dendritic processes plays its part in bone remodeling. So apart from that, the other types of cell that you should know is the osteoclast. Now, what is the importance of osteoclasts are cells which resembles macrophages. The production of osteoclasts are in fact driven by osteoblasts. Osteoblast produces two types of chemical messengers which have an important function in the differentiation of osteoclasts with the fusion of macrophages that are coming from the bone. One would be rank L, the other would be colony stimulating factor of macrophages. So these are the two which will play an important role in the differentiation of osteoclast. Now, osteoclast, what does it do? It will secrete collagenase, cathepsin. These are all enzymes, and maintain an acidic environment where the bony matrix is broken down. The bony matrix is broken down and dissolved to cause bone resorption. So this is bone resorption, and osteoblast is involved in osteogenesis, bone production. Osteogenesis and in an adult, osteogenesis and bone resorption should be present in a controlled manner where the rates has to be in an equilibrium. However, if this does not happen, there is a possibility you would see certain diseases such as osteopetrosis, Paget's disease. There are many more, you name it. But this process has to be in harmony with one another. So once this is in harmony, we and these processes are present in harmony with one another, and the process is known as remodeling of bone. In remodeling, it usually happens in an adult as well as it is present in almost everybody. But what you would see is that there is bone resorption. The old bone are broken down or dissolved by means of osteoclast, and the new cells, the osteoblasts that are present in within the particular area will start producing new cells to replace them. So this goes on in a cyclic manner. The osteoclast cells are usually stimulated. Now this happens in a very different manner. If you can remember, parathyroid hormone will try to make sure that the bone is dissolved and the calcium levels are maintained at a higher level. So this is the usual function of parathyroid hormone or parathormone. What it does is that it will stimulate osteoblasts to produce more rank L and CSFM to make sure that the osteoclast progeny is the population becomes more dense, and thereby will promote bone resorption. Osteoclast cells are inactivated or inhibited directly by means of another hormone which counteracts parathyroid hormone, which is known as calcitonin. And also, these both osteoclasts and osteoblasts are sensitive to thyroid hormone. This is why sometimes when there is decreased production of thyroid hormone or hypothyroidism will lead to cretinism in small children, where the production of or the bone elongation and the bone growing is somewhat hindered. Yeah, so this is what you usually see in the cells. You can look. I'll just give. So this is the normal action of the osteoclast. The osteoclast is the what it does is that it will try to make sure that the pH is kept in a low value, or the environment is maintained in an acidic state. With the acidic state, it will start dissolving the bone. But what's evident is that if you see this, this is an osteon, right? In the osteon, the outermost region consists of osteoclast, which will carry out bone resorption. In the inner layer, you would see osteoblasts, which will try to replace the cells that are already dissolved. Right. So, before going to the questions, now as I said, now in a long bone, in a long bone, you would see metaphysis. In the metaphysis, you would see the epiphyseal cartilage. However, something that has to be stated is that this epiphyseal cartilage has few zones. This is the epiphysis and this is the diaphysis. So it has few regions or zones. The initial region is known as the resting zone. The resting zone contains of nothing else but the cartilage. Then there is the proliferation zone, where the cartilage starts to divide and produce new cells. Then there is the hypertrophic zone. What does the hypertrophic zone do? It is composed of swollen. Now the cartilageous cells are known as chondrocytes. These are swollen cells. These swollen cells has glycogen in it, and this will, now once they are swollen, this will um, compromise the amount of blood that is flowing into these specific areas. This is why after this, now with the hypertrophic zone, you would see there will be calcification. The osteoblast will come into play. It will start producing osteoids. The osteoids become mineralized with calcium containing material. Now something that I have to say in between, this is not relevant to this, but the bony matrix is initially composed of osteoid, which is an organic material which is secreted by osteoblasts, but later the osteoids becomes uh, calcified. This composed of usually a mineral which is known as hydroxyapatite. Apart from that, you would also see within the matrix certain few other inorganic materials constituting of both sodium, potassium, and even magnesium, and certain level of bicarbonate and citrate as well. Um, so the bony matrix is composed of a mineralized region. Now this is known as the calcified cartilaginous zone. So what would you see is that the hypertrophic zone, which composed of swollen chondrocytes, are now becoming calcified. Um, so the chondrocytes are actually lost, and you would see the formation of bone, calcified cartilaginous zone, right? So later on, you would see the fifth layer is the ossification zone. The ossification zone is primarily composed of bone, and these cells usually consist of osteoprogenitor cells as well as osteoblasts. These usually you would see the osteoblasts settling in layers close to the calcified chondrocytes, and later on they would form the initial form of a bone, which is known as the woven bone. In the woven bone, the collagen are more or less oriented in a very haphazard manner, doesn't have that much of strength. However, what you would see is that later this woven bone will undergo transformation to form lamellated bone. So this is what you would see. Now once in an adult, usually the epiphyseal cartilage is completely ossified, therefore it will the fusion has taken place, that is how we say it. So after that you would not see any translucent areas, and this is how you would this is how X-rays can be used to identify whether a bone has grown or developed according to the age necessities. Now, for an example, let's assume this is the bone, and usually there are the ossification centers. There are a few ossification centers. These are known as secondary ossification centers. I'll go to them once I start speaking about how ossification takes place. So let's assume this secondary ossification center is to be completed within the first month. This is in 2 years, this to be in 3 years, and this to be in 7 years, and this is in 21st year. So patient comes in and I do an x-ray of this particular bone, and I would see that this patient is in fact 15 years of age. Now what I would see is the existence of only the epiphyseal cartilage of the region which is to be ossified in 21 years. All the others have been fused and are completely radiopaque. So this is how we determine bone age, because there are multiple number of ossification centers which fuses at different ages. And with this we can come into a conclusion whether the growth of the bone is taking place in a good manner. If not, certain interventions has to be carried out, right? The final would be the final thing that I have to describe or illustrate would be the bone ossification. There are two types of ossification that we come across. One would be endochondral ossification. The other would be mesenchymal ossification. Endochondral ossification usually evident in long bones. Initially, what you would see is a cartilaginous model of the bone. Later, this also consists of a periosteum layer, which is known as the periosteal collar or the bone collar. The bone collar will limit the amount of, now since it is very solidified, it will limit the amount of blood flowing into the inner regions. Therefore, what would happen is that the inner area, usually the chondrocytes, are deprived of blood. Therefore, it starts to degenerate. And with the degeneration, it will start producing certain chemicals that will allow blood vessels to grow into the cartilaginous model. So these blood vessels are usually seen to uh, to the central area as well as the extremities, which are the epiphyses. Now, what would happen is that in the innermost, in the centralmost part of the cartilaginous bone, you would see the differentiation of few cells which are known as osteoblasts. Now, these starts producing new bone tissue. So, since this starts in the fetal stage, the bone that are produced comes through a process which is known as primary ossification. So usually what would happen is that bone starts producing from the central region and moves to the extremities. The extremities are not yet calcified. So with time there will be elongation of the bone. However, the most calcified area you would see would be the diaphysis and the extremities of the epiphysis. However, the regions that are present in between will stay constant. They will have cartilaginous components. This is why even after birth there will be no longer any bone formation at the central part of the bone, but you would see bone elongations occurring from the metaphysis or the metaphyseal region. So this is endochondral ossification. Now after birth, you would see the presence of epiphyseal cartilage involved in bone elongation. This is known as secondary ossification centers producing new cells or bone tissue to the extremities causing elongation. So this is secondary ossification. With time, even from the fetal stage itself, what would happen is that now once this gets calcified, once this starts getting calcified, you would see formation of cavities in the central region. This cavity is usually occupied by bone marrow. Initially by red bone marrow, but later by yellow bone marrow because it becomes infiltrated with fat. That's why long bones will produce red cells in the initial stage of life, but will come the production of red cells are rather becoming lesser and lesser once you age. Let's assume that there's this patient coming with 35 years of age, and the production, I can say definitely that the production of the number red cells from the femur or the humerus is very insignificant or very minute in quantity. Cannot say zero, but minute. So this is what happens in long bones. But when it comes to flat bones, usually there is this mesenchymal regions. From the mesenchyme, you would see the, you would see uh, the proliferation of mesenchymal cells to form osteoblasts. The osteoblasts will involve in production of new bone tissue, and that's how the bone tissue will again this has a periosteum as well. So usually the periosteum will retain, forming two trabecular plates, and the in between the trabecular plate you will see the chondrocytes getting deprived of oxygen. So these chondrocytes will eventually die out, forming cavities. The cavities will form bone struts, and sometimes the bone struts are occupied by bone marrow. So this is how it happens. So mesenchymal ossification, that's how why mesenchymal ossification has multiple number of primary ossification centers, whereas long bones usually has one in the central region, and the secondary ossification centers are now quite higher in number when it comes to when it comes to endochondral ossification. Right. So now we'll go to the questions. Going Some small thing that I have to say is that in fractures, what would happen is that usually the periosteum and the blood supply to the periosteum is disrupted, broken down. So what would happen is that initially there will be bleeding into the site, and you will see a formation of a hematoma. The hematoma, along with some of the cells, some of the chemical molecules that are produced because of the trauma or the stress related stress mediated disruption that happen, what you would see is that it will start stimulating the osteoprogenitor cells as well as the osteoblasts of the periosteum to produce. I'm just gonna illustrate the osteoblast activity by means of yellow. It will produce a fibrocartilaginous, fibrocalcinous cartilage. This is not very firm yet, but yes, it has its function. So fibrocalcinous cartilage, which is termed as a callus later. The callus, with the action of the osteoblast as well as osteoclast, it will undergo remodeling, where it will initially form a rather a weak microscopic bone which is known as the woven, and later will form a lamellated bone. Woven bones are seen only in fetal stage as well as in the pediatric stage, but in a normal adult usually does not have any woven bone. However, can happen if the adult has undergone some sort of a fracture and is healing from the process. So woven is primarily seen in bones which are either healing or fetal or pediatric bones. Bone remodeling is something very important, and this is the foundation for orthodontics. That's how we usually uses these different equipment to make sure that the bone the skull, the shape of the skull is remodeled, and the dentition is kept in a quite in an aesthetic manner. And also something that I have to say is that even the brain, the skull has its bone plasticity. It undergoes remodeling. This is how it accommodates a larger brain. And if not for this, the development or the enlarging of the internal organs will somewhat be compromised. Right. So we'll go to the questions. So right now we'll be looking at the questions. Now, the first two questions is based on the anatomy of the joints, which I have not discussed here, but let's go to C, D, and E component. Trabecular bone is found in fracture healing sites. What did I say? The fracture healing sites are composed of woven bone. So this is a false statement. Compact bone is found in bone marrow cavity. Usually, the bone marrow is found within spaces that are found in the bone structs, so composed of spongy bone. Compact bone is somewhat is not seen ideally in regions where you see bone marrow. Again, a false statement. Woven bone is found in fetal bone. Yes, that's a true statement. So as I said, woven bone will undergo transition from woven to lamella once the bone starts to get matured, and this is usually not seen in uh, adult individuals. However, in healing sites where it has been a fracture and the fracture is undergoing healing, then of course there is a possibility you would see woven bone. Apart from that, no, woven bone is not to be seen in an adult. So these are questions about joints. I just give you an answer. Hyaline cartilage is found in the epiglottis. Yes, that's a true statement. A fibrocartilaginous joint is found in a PV symphysis. Yes, that's a true statement again. So the next question is chondroblast. Now, correct pair. The chondroblast and the periosteum. Now, where did I say? Periosteum is composed of osteoblasts, osteoprogenitor cells. So chondroblasts are usually not seen in periosteum. But of course, there's an articular cartilage cap that can be seen in the extreme of epiphysis. But apart from that, no, that's a false statement. Chondrocyte in primary ossification centers, as I said, the cartilaginous model, the primary ossification center is found in the central region. Because of the compromisation of blood, the chondrocytes undergo transformation to form osteoblasts. These osteoblasts will produce the matrix and will cause ossification. So this is not the primary ossification center. Chondrocytes are seen. Yes, that's true. Osteoclast in epiphyseal site. What is the baseline phenomena that we use? Osteoclasts are involved in remodeling. So anywhere where remodeling is present, osteoclasts are to be seen. So as I said, in a normal bone, usually the epiphysis, the diaphysis undergo bone remodeling. The only region where the bone remodeling does not take place is the epiphyseal cartilage or the metaphysis. So both in diaphysis and the epiphyseal region, you will see osteoclast because it is involved in bone remodeling. Yes, but in the metaphysis, again, osteoblasts are seen everywhere as well, but in the metaphysis as well, because if you can remember, the metaphysis consists of a particular zone which is called as the which is called as the ossification zone. This ossification zone composed of osteoblasts. So this is a true statement. Osteocytes are present in the Havasan system. Yes, the interstitial lamellae. One thing that I have to say, osteoclasts are found in certain lacunae which are given the name Howship's lacunae. So these are found in lacunae. These lacunae are kept more or less in an acidic manner by the activity of osteoclasts. Osteocytes in the Haversian system. Yes, that's a true statement. Of course, the Haversian system is composed of lacunae which harbors osteocytes. Osteocytes that communicates with other osteocytes of the lacunae by means of small thread-like material which are known as dendrites, which are sensitive to mechanical stress. Osteoblasts found in bony fracture sites. Yes, as I said. So a very good question. The second question was excellent. You require a little bit of knowledge. So these were past paper questions that were given. So you see the 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 range, the versatility that they usually examine you. So the next tutorial will probably be of pathological diseases that are associated with bone, and I'll be doing a very brief and important one which would be very important for you to keep in mind even to your final years as well, so that you will remember most of the diseases that are related with the bone. So until next time, bye.